morning, everybody. Thanks for inviting me. And thank you, Meg, for introducing us to Stephen and Peer Talk. It was a real privilege, actually, to have an evaluation on the shelf that two of our master's students could complete as part of their mental health nursing. And it's something that we've been looking to develop for quite a while. So for us, it was a really interesting opportunity to enable two of our students to carry out an evaluation, but also for us to begin some of that, to comment on your work. So I want to, Jesse Usman was the student who was working with me, or I was working with him on the evaluation of the literature. So, and I think Jesse's here this morning, but this picture on the left here actually is from Northern Ireland. It's from the Beyond Words project, which was run by Cruz, and they have a quite a that, like many organisations, like Peer Talk, they work on the basis of people looking and supporting each other. So I took that picture because I think it speaks everything about what we're going to talk about this morning. Okay. So I want to talk about groups. I've been a psychiatric nurse for 35 years, and I've always engaged in groups. We are born into a group, generally speaking, aren't we? We learn in groups at school. We form groups outside school as sport and friendships, and we work in work groups. And so for me, they are essential as part of human communication and support. So, and if we go into some of the research and textbooks, Stewart and Sundin say a group's a collection of individuals who have a relationship to one another, are interdependent, and may have common norms. And myself and John Wren in a textbook have said in group therapy, the client can be the therapist as well as the group itself. And I think that's where I sit in terms of groups, that I've supported and helped manage groups all my career, because I see them as really highly effective as a way of getting help. And in the NICE guidelines, the steps towards dealing with depression are that in step 1, assessment and interventions like groups can be part of the treatment. In step 2, further assessment and interventions can be, groups can be part of the treatment. And in step 3 and in step 4, and even, that I've managed acute psychiatric wards, and on the wards we run groups because we think they're essential to helping people manage their mental health. So what's the extent of our problem? Well, we know that depression globally affects 248 million people, according to WHO, and it's the highest contributor to the overall burden of disease. In mental health, in the UK, the cost of the economy is estimated at about £105 billion, which is a significant cost. Depression is the most common, one of the most common mental health problems in the UK, affecting 1 in 10 people. The economic cost is 11 billion in 2011. I'm sorry, I couldn't find a more recent figure for that, but I'm sure somebody will have one available. Depression's ranked by WHO is the single largest contributor to global disability, and it's also a major contributor to suicides. And I think suicide in the UK is one of our is a disgrace. The young men, particularly who are ending their lives, they need an infrastructure and support, and I'm hoping that going forwards we can provide more of that. Okay, so what is it about groups? Well, they're just human nature. Fuchs in 1991, and Fuchs is one of the Andy Hallam and a few other people are sort of seminal writers on group dynamics. And it is the greatest importance to realise that it is this form of treatment, the group itself, is the activity for change. And I've seen how groups function and how groups can support and work with each other. And Yolande talks about how groups instill hope, create universality, impart information, are altruistic, and can act as this corrective recapitulation of the primary family group. And that's about, like I say, we're born into groups, and so it's natural for us to look at and support people in groups to help with distress. I'm very interested in social prescribing at the moment. I see a lot of, the funding that's come into social prescribing and green social prescribing in particular, very much focused around groups. And last year, John and I completed quite a big study into young people's psychological well-being. And we found that as part of that, there was social prescribing across the whole country. In fact, in Cornwall, if you're a young person struggling with their mental health, you might be referred to a surf school. And I just thought, wow, that's amazing. You know, what an amazing way to help somebody manage their mental health by using exercise outside, supportive therapy, but also using a group. And I've been coaching rugby for 20 years, and I see the benefits. You know, I meet my group of rugby players at the age of 5, and I see them develop because they're in a group and we manage the texture of that group properly. And we know that there's multiple self-help groups across the UK. You know, you only have to look on the internet. You've got some condition that's bothering you, you can go and look for a self-help group. And I would say, you know, there's probably one available for you. There may not be many, or is not enough of them, because for sure, if we didn't have organisations like Peer Talk, like Cruise, like Rethink, like Mind, the mental health services, I think, would buckle. You know, that if it's not for us altruistically supporting each other, and actually, that's exactly a perfectly reasonable thing to do, isn't it, for us to support each other with guidance. So at Davidson, they talk about how groups support and manage social ties, how the influence of social ties maintain health. Dennis and Dowsall have found that social support enabled individuals to deal with stressful events and conditions, functioning as a protective agent against common mental health disorders. And Lloyd Evans defined a social network as a system composed of several individuals, functions and situations, exactly what Peer Talk offers. Okay, so what is it about peer support in particular? Because we have experts by experience teaching our mental health nursing students at Sheffield Hallam. We, they're sometimes called experts, sometimes called wounded healers. Well, I think people who've got a lived experience of something can be really valuable and helpful to other people with a lived experience. So peer workers are individuals with a personal experience of a mental illness who assist others. Peer support refers to a mutual exchange of practical and emotional support between people who relate as peers. Peer support's a comprehensive recovery plan that emphasises person-centred patient outcomes, such as empowerment and inclusion. Peer support supports others through positive self-disclosure, emotional and practical support, empowerment and expanding social networks, and promoting hope. Peer support can improve social support, social function. Peer education can improve compliance. Peer support can help patients establish new relationships, not as a patient and a healer, but as friends who are equal. And peer support shows that the recurrence rate of depression for outpatients who receive peer support services was reduced by 50%. And let's just focus on hope, just briefly. You know, we're all hoping at the moment, aren't we? We're hoping the pandemic will go away. We're hoping that we can get back to our normal lives. We've got such a job to do in terms of our sort of cultural mental health in the UK post-pandemic. And I think for me, peer support and peer support groups are going to be invaluable as part of that, because we can't keep asking the NHS to manage events. You know, we as a society should be managing events. So but you know, here we are with peer support. What's important about it? Well, actually, any group needs a conductor. It's we had this discussion this about the usefulness of a conductor. The term comes from psychodynamic group psychotherapy, and the conductor has responsibilities for just managing the way the group works and the group facilitation, supporting and ensuring boundaries. And conductors are absolutely essential, trained conductors for any group to succeed. And I asked questions at Peer Talk about the conductors, and I got really good answers back, actually. You know, answers that for me help establish the usefulness of peer support, because Peer Talk conductors, they have a training program in place for conductors. They manage the texture of the dialogue and sharing within each group. There's a genuine lead for the group who has some training and counselling skills. The conductors themselves are experts by experience, so they're peer supporters, and they have supervision, debriefing and reflective practice. And those are all the essential elements of somebody leading a group of people who to help change and instill hope. So where are we now? Well, we're understanding the evidence, for sure, we'll understand it. And it was a really good and enjoyable experience actually managing this evidence. The evidence base is embryonic, and yet actually peer support in its wider context has been around since the beginning of human civilization. But because we haven't got our hands on all the evidence yet, doesn't mean it's not there. So our position is, you know, certainly as academics anyhow, is if we look and evaluate, we'll find. And there's some references for you to look at later. Let me just stop share. So that, I think my brief was only to have a few minutes. So I hope that I've enabled you to get a sense of where our thinking around the project has come from, and also the wider context of group therapy and group approaches to mental health. Okay, thank you.